my work here was focused on studying the spinal cord because we know that the cervical spinal cord is very commonly affected in MS in up to 80% of the people. And the damage in the cord can contribute to motor, sensory, autonomic dysfunction, and overall worse disease outcome. But unfortunately, in the past, there have been much fewer magnetic resonance imaging or MRI studies done in the spinal cord, only about 20% compared to the brain. And this is because it is more technically challenging to image the cord. But in the past few years, there have been lots of advancements in the acquisition protocol, post-processing software that made spinal cord imaging more feasible. So another clinical challenge is that there is a very limited number of treatment options for progressive MS, only one for PPMS and one for SPMS, which are only modestly effective. So in order for us to develop better treatments for progressive MS, we need better ways to monitor progression in MS. So MRI surrogate measures can help to monitor progression in MS and serve as a more objective outcome measure in clinical trials. Now, another challenge is that the clinical or conventional MRI is not very sensitive, not very specific to clinically relevant tissue microstructural changes. And there is often very limited association between the lesion load, the MRI activity, and the clinical disability, especially for progressive MS. So this is where I apply the advanced quantitative MRI technique, particularly in the cord, that can come useful because it is more sensitive and specific to tissue microstructural changes, and it can be used to monitor progression in MS. And an example of advanced MRI technique that I used in our study, which maybe I'll mention a little bit more later, is called magnetization transfer or MT imaging. That is more sensitive to study tissue microstructure than conventional MRI technique.